Looking for a new dentist? Watch this first. Welcome back to Gentle Dental. I am Dr. Chinnery, and today we are going to be talking about what to be looking for in a dentist. Before we start, one important mindset shift. We're going to talk about insurance versus quality care because this matters. You have to remember sometimes the level of care that you receive is directly tied to whether you're able and willing to pay without letting insurance dictate every decision. If your priority is whatever your insurance covers, then that's a simple, easy fix. You just go onto your insurance company's website and search for a dentist. But if your question is, where can I get the best quality care, who provides great communication, and have a great experience? Then listen up, because there are a few things that really matter. The first thing we're going to talk about are Google reviews. So this is kind of a hot topic in the sense that there are a lot of factors with it. So Google reviews are helpful, but it's not always the whole story. You want to look for consistency over perfection. A steady pattern of 4 to 5 stars matters more than the one outlier. Look for recent reviews within the last 6 to 12 months so that you know what is current in the existing practice right now. Also look for what people are complimenting or complaining about, the staff kindness, if there's long wait times, or if there's any billing confusion. Some possible red flags: if there's multiple reviews that say that they felt rushed, that nothing was explained to them, or if they felt pushed into treatment, or even sometimes if there's complaints about surprise bills that they weren't aware of. Here's the truth. So most people that leave reviews are upset. If you have a great experience, a lot of the time we don't take the time to actually write a good review. So know that ahead of time. And if you do have a good experience of dentists, please write them a good review because it really does help. So again, take the bad reviews with a grain of salt. Another important thing that patients don't always realize is that we can't respond with details or defend ourselves because of HIPAA. Even if a review is totally off base and there's so much more to the story, we don't have the ability to combat it, and we legally can't explain what actually happened. There's a high chance that that person is just a very unhappy person. Everywhere they go, there's not going to be an office or a doctor or a location that will go up to their standard. So again, look for patterns, not one-off reviews. Number 2, it's important to look for the type of procedure that an office does, especially if you are looking for a specific thing. It's completely okay for dentists to refer for complex procedures or specialized procedures. Does not mean that they're a bad dentist. This means that they're going to get you to the right place. What does matter is that if there's a specific procedure that you actually want, you need to make sure that they do it. So if you're looking for one-time crown visits or Invisalign or implants or anything like that, that you just either look on their website or give them a call to see if they do that. Number 3, we're going to talk about hygiene appointments because this is a really big thing. Most of the time you spend most of your hours in the dental office with your hygienist. The dentist usually just pops in, does a quick exam, and pops out. So for the most part, hygiene is very, very crucial. Great questions to ask are how long is your dental cleaning? Is it 30 minutes, 60? All of those are very office dependent. If it's 30 minutes, then you need to ask yourself, will I get a sufficient, deep, a good cleaning if it's only 30 minutes long? That is something that you need to know and figure out between getting the health history and x-rays and all of that. It goes by really fast if you only have 30 minutes. Another question that you can ask is who's doing the cleaning? Is it a hygienist, a dental assistant, a dentist? An important clarification is that dental assistants are not able to scale in general, especially below the gum line. And so a hygienist or a dentist, which both are qualified to do, if you have kids that are under 12, most of the time they don't have anything too crazy going on. So having a dental assistant is common to do the kids' cleanings, and then the dentist pop in or the hygienist just verify that everything is clean. That's something that you can ask the front desk, and especially when you're making the appointment. You can verify, double check. So again, when we talked about the different schedules, if the doctor has 2 columns and the hygienist has 1, if it's a kid cleaning, sometimes they'll put it in this doctor's second column, which means that it's going to be most likely an assistant and then the doctor checking. Sometimes the hygienist, if they're free, they'll pop in, but that's something that you can ask to see, hey, can you put me in the hygienist schedule? I'm assuming the call center or the front desk will be a little shocked to hear that, just because most people don't know that. So they'll get brownie points. And then another factor is that dentists, for the most part, they don't love doing cleanings. My school was very focused on cleanings, and so it doesn't bother me. But for the most part, a lot of dentists don't actually enjoy it. With that said, sometimes you may not get the most thorough cleaning with the dentist. It's just, hygienists that's what they do, that's what they love. So that's what they're trained to do. Things to know and be aware of. Another factor to keep in your brain is if you're an adult, are your gums being measured? Because if not, if they've never been measured, then maybe you're not getting the type of cleaning that you need. There could be bacteria underneath your gums that are starting to eat away your bone, and so that's something to just keep in mind with. Even if you go to the dentist every 6 months but you're not getting the full cleaning that you need, it can add up. So think about, are your x-rays getting explained? Are you getting to look at them, and are you able to see where the beginning of cavities are forming, or is it just take them and then on to the next? Lastly, do you feel understood when you're there? Do you feel like people are explaining things to you? Do you feel rushed? Do you feel like you're getting shoved out the door? All those things are really big and important to remember. And if I'm being honest, there are times that I have patients that walk out the door and they're still confused, and it makes me really sad. Sometimes it takes another visit, another patient coordinator explaining things, a dental assistant, a hygienist, the office manager, me coming in again and explaining it on a different day, just when you've had some time to think about it. And that is totally okay. Never, ever feel embarrassed if you don't understand what's going on, because dental terms and terminology and dental care in general is very confusing. It's really important that if you don't know, just say you don't know. Sometimes we can read your face if it seems like you're overwhelmed or it's just not clicking. We don't know how to help you unless you tell us. So just, if you don't understand, just say, hey, I'd like some time to think about it. Can I come back and ask questions or whatever? I'd be happy to see you again. One thing that is a little bit taboo, but it does get challenging whenever people say oh, you're just trying to buy a boat, that's why you want me to get a crown. And that could be further from the truth. There's a lot of things that hurt general feelings, but you would never say that to a medical doctor. And what people don't understand is dental education is very, very expensive. Our materials are crazy expensive. Our lab bills are very expensive. Overhead in general has skyrocketed. And this is not meant to be a pity party, but just for you to be mindful that those words do hurt and it's not accurate to the representation. Dental insurance has not changed their reimbursements for about 20 years. So everything has gone up. Reimbursements have stayed about the same for the 20 years. Just know that, especially if they're taking dental insurance dentures, a lot of times the reimbursement, by the time you get the lab fee and the chair time, you're actually not making any money. So a lot of offices don't even offer dentures anymore because of that. But we do want to help you, and just know that we're not there just to get a boat. Number 4, we are going to talk about communication styles. The good news is that you have choices. Not everyone is going to mesh well together, and that's fine and great. And so it's important to be able to know that and figure out a dentist that works best for you. If you don't connect with a dentist, a hygienist, assistant, front desk, whatever it is, just tell someone. And even if you want to call and tell us later, we can write that in your chart, and then the next time if there's another provider that is able to see you, they will. Totally fine. We just want you to be able to feel comfortable and confident. Another thing is, if you have dental anxiety or you've had bad experiences in the past, or if you're fear of having pain, then notify when you make the appointment, and then also when you check in, just so that we can be extra mindful and walk you through things slowly and keep you calm. So it's a very important thing to know, and it's very helpful to know ahead of time. You can also bring a blanket, a squishy tool to squeeze. You can bring headphones, or if there's a second monitor, they can maybe put on a show or a movie or some type of distraction just to help you. All right, so number 5 is treatment planning. Things you want to look for are clear explanation of your x-rays, or if they take any intraoral photos, that they're able to identify what's going on. Written treatment plans, time to think, like not deciding on the spot unless you like come in for a limited exam. Sometimes if I have an opening and patient cancel or something, the patient's already in the chair, I'll be like, hey, you want to do the filling now? And they're like, yeah, sure. I'm not like, you're gonna do the filling right now. That's a very different mindset. It's more just of convenience at that point. So a lot of times we will do like same day switchover, but if we're free, but it's not like a sit and stare at you. Like usually I like to like kind of, I'll give them the option, or like I'll tell the assistant, and then I'll like actually leave so that the assistant can introduce that to them, so that it's not like pressured, because I don't want them to feel like I sat them down and made them. And then they're kind of figuring out like the honest answers with, what's urgent versus like what can wait or what we can monitor. There's a very fine balance between that. There's dentists that are like crazy conservative, and then there's dentists that are not conservative at all. And remember, like I said earlier, we have feelings, and so sometimes when we don't want to hurt your feelings or don't want to overwhelm you, or we may be a little bit too conservative and say we're going to watch a few more things and we might have normally not. It's just kind of dependent on the situation, doctor, patient, everything. So I would say if you're going to the dentist every 6 months and you get 14 new cavities at a new dentist, it may be possible that all 14 cavities cavitated through into the dentin, which is the middle part of the tooth where we have to fill, but I'd probably get a second opinion at that point. So just kind of know that if you sat 10 dentists in a room and you gave us all x-rays and intraoral photos and all the things, you probably, I don't know if you would say 10 different answers, but you would probably get like 5 different answers. So just know that we are trained similarly, but sometimes people, depending on their experience and all of that they may do different things. I'm in a dental group on Facebook, and it's like crazy how many be like, here's the situation, what would you say? And like hundreds of people will comment and they all say different things. Just know if you don't feel confident in your situation, just visit a different dentist, give the second opinion, even a third, and figure out what you want your mouth.
Number 6 is the office environment and cleanliness. Is the front desk staff welcoming when you come in? Patients often underestimate how much the environment affects their trust and anxiety. Cleanliness is a non-negotiable. If you notice gloves not being changed, hands touching everything in the operatory, poor sterilization habits, you should probably just go somewhere else. Disease can be spread in unsafe environments, so just go somewhere else. Number 7, trust your gut. If it feels off, it may just be. There are so many dental offices, you are allowed to try another one if one doesn't feel right to you. A few insurance notes on that is that a lot of times insurance companies will only cover a certain amount of x-rays in a year. Sometimes if you get them transferred, an office will just write off the x-rays they take just so that they're able to identify what's going on. But if they don't, they should be able to tell you up front before you see them. And also, please don't call asking how much is it cleaning, because it's not that easy. As I've mentioned before, they can give you a cost for the examination and the x-rays, but the cleaning wise, we need that information as well as your measurements of your gums to determine what kind of cleaning you actually need. So it's not that because they don't want to tell you, it's because we don't know what you need yet. You can get a range, and they can give you an estimate of what that range would be, whether it's a regular cleaning or a deep cleaning. And then just know that all of those numbers can change once you are there, and if you need extractions or anything that you may not know and we can't see via your phone. So just know that all those numbers are just very rough estimates, just to give you an idea. So to close, give us grace, we'll give you grace, and we will make it the best experience that we can so that we can get you back to your healthiest smile. The right dentist should make you feel calm, informed, and respected, not pressured or confused. Thank you so much for watching. Please like, subscribe, and comment any questions that you have or any comments that you would like to share. Thanks for watching, and I hope your 2026 is going great.